Hello, and thank you for your interest in the ESK-TRD 4005 research study. This study is examining whether an investigational nasal spray medication, when it is used alone, can help adults with treatment-resistant depression, also known as TRD. Over the next few minutes, this video will provide a general study overview, details about study participation, and information about the study medication. This information can also be found in the Informed Consent Form, or ICF, that the study staff will review with you. Let's get started. The purpose of this study is to learn if an investigational nasal spray medication called esketamine is safe, effective, and useful when it is used alone to improve depressive symptoms in adults with TRD. This study consists of 4 phases: screening, double-blind study treatment, esketamine nasal spray study treatment or observation, and follow-up. Before you can receive the study medication, you will go through the screening phase to determine if you qualify for the study. This phase could last up to 7 weeks and includes study visits for health exams and tests. If you qualify for the study and choose to participate, you will need to stop taking your current antidepressants for at least 2 weeks prior to the double-blind study treatment phase. Following screening, you will enter the double-blind study treatment phase. This phase lasts 4 weeks and will require 10 study visits as well as 10 video teleconference appointments. You will use an app on your smartphone to talk with the study doctor through video on the app. During this phase, you will receive either the investigational medication or placebo. Following the double-blind study treatment phase, you may discuss with your doctor whether entering the esketamine nasal spray study treatment or observation phase is right for you. If you are eligible and participate in this phase, you may choose to receive esketamine, standard of care treatment for depression, or both. This phase lasts up to 3 months and includes up to 16 study visits. Study visits may last 3.5 to 4 hours. If you receive esketamine or placebo at a study visit during the double-blind study treatment phase or esketamine nasal spray study treatment or observation phase, someone will need to drive you home. After the nasal spray study treatment or observation phase, you will enter the follow-up phase. This phase requires only 1 study visit. You will not take any study medication during this phase. Once you complete the follow-up visit, this is the end of your study journey. You will no longer receive nasal spray study treatment. You can talk to the study doctor about other treatments that might be right for you. Esketamine nasal spray, the medication being evaluated in this study, has been approved by the United States Food and Drug Administration for the treatment of TRD in adults when used in combination with an oral antidepressant. Esketamine is considered investigational for this study. This means that it is still being studied to see if it is an effective medication when used alone for adults with TRD. During the double-blind study treatment phase, you will have a 50% chance of receiving esketamine and a 50% chance of receiving placebo. You, the study doctor, and the study staff will not know which you are receiving. Placebo looks just like the investigational medication, and both are administered as a nasal spray. However, there is no active drug in the placebo nasal spray. You will be provided with instructions describing how to take the study medication. You will practice how to use the nasal spray device at your first study visit during the double-blind study treatment phase. At study visits, you will administer the nasal spray yourself under the supervision of the study staff. Some patients treated with esketamine have experienced side effects. Very common side effects include feeling disconnected from yourself, your thoughts, and things around you. Dizziness, nausea, sleepiness, headaches, spinning sensation, anxiety, and increased blood pressure. There may be risks and side effects with esketamine that are not yet known. Please contact the study doctor as soon as possible if you experience a side effect or feel unwell during your study participation. You will not be paid for being in this study, but you may receive a stipend to help with expenses related to study visits. The study sponsor will pay for the study medication and tests that are a part of this study. You can agree to join this study and change your mind at any time and for any reason. Your decision to leave this study will not change your regular medical care. While you may benefit from study participation, this is not guaranteed. However, your participation may help future patients with TRD. Thank you for taking the time to learn more about this research study. To begin the screening process, you must first read and sign the informed consent form. If you have questions about the ICF or want to know more about the ESK-TRD 4005 research study, please speak with the study staff. We would be happy to talk with you about your potential participation.